Hello and welcome to our another episode of Coffee and Conversation, AI in Healthcare. I'm Michał Urbanowicz, medical doctor and senior marketing manager at Informatica. And we are here today with a special guest, Henry Stoneley, head of UK and Netherlands for Health Europe. Henry is pioneering the expansion of the health event across the pond in Europe. Henry, we are excited to have you on today. How are you?
Yeah, really good. I'm super excited to be on as well. I always love hanging out with the Informatica team, so it's nice to be here.
Awesome. Thank you so much. So let's jump into our topic. So Health Europe 2024. I would love to dive right in to talk about the countdown to Health Europe 24. And health has had a huge success in the US over the past couple of years. And it will debut in Europe next June, which is super exciting for us as a company that's originated from Poland in Europe. So question to you, what will be similar and what will be different from what we've seen at Health US this year?
It's a really good question. So I suppose at a really high level, the DNA is the same, but it's going to feel a little bit different. So if we take what health is for, whether it's in the US or in Europe, health is always pan healthcare. So it's everyone from like government to patient groups, life science, biotech, health tech, VC, payers, providers, absolutely everyone. So that's something we're very much bringing over. Obviously, we are pan-European as well, with maybe 15% of our attendees coming over from the US. So it's got a nice global feel to it, which is again very similar to health in the US. But I guess the main change in terms of feel to it is that it's a little bit more light, airy. We have a real focus on breaking down silos across Europe, so bringing everyone together. The venue, RAI, is, like I said, super light and airy, so the feel that the team are putting together reflects that. It's kind of bright, beautiful light. We're also laying the whole thing out in the shape of a human body, so you've got the main stage head, you've got a DJ or DJs, multiple DJs, where the heart is. Lots of really exciting kind of visual stuff. And then I suppose, Vegas is a city that comes to life after dark, and health's styling there kind of reflects that. Whereas Amsterdam, which is also an incredible night out, I'm told, has a much more like embracing vibe. So I suppose the way that both events feel reflect the cities they're in, which we love. So yeah, it's going to be very similar if you've been to health in the US, which obviously I know you have, but for anyone listening who's been to health in the US, a very similar feel, but with a European twist.
And I know your team has been diligently researching how to bring the health vibe that you mentioned already as the framework from the US, but shifted to fit our European culture. From your perspective, what's different from the European standpoint as it relates to healthcare and in general the whole industry?
I suppose the biggest thing is in terms of the audience split and who we're pushing for. We have a much higher focus, or a much stronger focus, I should say, on public health systems and providers. Obviously, with all bar one of Europe's health systems being sort of predominantly public or public insurance-based models, that is a much bigger push for us in the US, whereas in Europe, whereas in the US, you've got a lot more along the lines of employers and insurance companies and various other places. So there's a big push for us to get lots of payers, lots of providers, lots of health systems there, because we feel that they're the people who can help us to create the most change in Europe. That's probably the biggest sort of on the ground noticeable difference between the two events, will be those attendees. So they will make up a really large chunk of the people who are at health. We will still be, and we're tracking slightly above at the moment, 35% CEOs attending health, which is great. That's what the US does. That's what we would like to replicate, but just with a slightly different audience.
Awesome, thank you. And we've seen your health memo, European Health News Unboringed. It's a creative way to get more people interested in sometimes dry topic, as healthcare can be. To go with along with the Unboringed theme, what are your three most captivating things for people to look out for at Health Europe?
Thanks, that's really kind. Yeah, I've written a few newsletters in the past, and this one's a bit more of a challenge because the audience is pan-European. I'm obviously from the UK, if my accent didn't get away. So writing-wise, I use a lot of idioms, phrases that are really British. So it's been really fun and a bit of a challenge for Elle, who's our marketing director, and I, to create something that doesn't just rely on really weird British jokes, which is nice. In terms of captivation as well, I love that word. It's really health. So I could talk about like individual sessions, but then I'd be here all day because there are so many of them. So I think the three big things for me that are the most captivating to look out for at Health Europe. The first one is definitely independence of content. So we don't do pay to play. We never have, we never will. You can't sponsor and therefore get a slot on stage. It will never work like that. And that obviously makes everything a lot harder internally for us because people are used to doing that. And nobody else does that. Usually with a conference, you can say, here's X thousand euros, therefore I will get a keynote. And we don't do that. And that's really important to us. So I think it's one of the big things to look out for, because it means we can create an agenda that is genuinely challenging, genuinely pushing the boundaries of what people are talking about. Lena Burns, who's our head of content, and Katie, who's our MD, had hundreds and hundreds of hours of conversations with everyone from government ministers to patient advocacy groups, life science CEOs, big pharma people, like the entire smorgasbord of healthcare, in order to build an agenda that was independent and a little bit spicy, I guess is probably the word I'm looking for. Not sure, I need to find a better word for it. But to build that agenda out, that means that we're having the conversations on stage that we all have behind closed doors. When we think no one's listening, we'll talk about, oh, we really need to change this, but no one's really pushing it. And then we will write that into the agenda and then find the best people. So rather than, like I said, rather than having kind of constant sponsored content where you feel like you are paying to listen to someone pitch to you, it's a genuinely progressive agenda that helps to address the next 1 to 3 years of healthcare. I mean, I've lost count of the times at events that I've been to sessions that are just thinly disguised sales pitches, or panels of people agreeing with one another because the questions aren't challenging enough. And I'm almost inclined to call that slightly rude to the audience that you've got. People have paid to be at events. They're there to learn and grow. And if it's the same content year after year, you're not doing your audience the service they deserve. So that's not health. That will be. That's the biggest one. Fiercely independent content. I'd say the other two are probably the seniority of the audience, which I referenced earlier. So obviously we're pan-European with a US influence, which means that you're going to see a lot of people who would be absolute certain nailed on keynotes in their country involved in much more interactive sessions. So you've got these incredibly senior leaders, 35% of our audience, like I said, are CEOs, and you've got them in really challenging sessions, and that creates an incredibly captivating environment where the best people are discussing the most difficult questions in healthcare today and really looking to push things forward. And then the third thing I would say that people should look forward to for health, sounds almost frivolous, but networking. I mean, obviously I work in content mainly, so agendas and speakers and things like that. So there's an element of bias in my first two answers, but nobody networks like health, in my opinion. There's sessions for everyone. There's like incredibly well curated chill out space and breakout space and meeting space. And we've got more of that than most events have actual floor space. So you can't really walk more than about 10 meters at health without finding someone to get a coffee, snack, food, sit down, chat to people. And the work that Charlotte and Ben and the logistics team put into making sure everything flows really nicely at health, to ensure everything is easy to get to and networking is natural, coherent, is incredible. Like, it's a really intentional effort to make sure that when you get there, there's so much going on that no one feels overwhelmed. You always feel like you know what you should be doing, and that requires a huge amount of effort. And on the day, hopefully it feels completely natural and effort-free for everyone else. Obviously, behind the scenes, we'll all be running around like lunatics. But yeah, that's a really intentional thing. I can't tell you too much about the evening events yet because I don't want to ruin the surprise. But I suppose the best way to put it is it's quite hard to shock me. When I sat through the presentation of what we're doing every night at Health in Europe, I basically had my jaw on the floor. So I can't wait, and I'm not really much of a party person. So yeah, those are the big three: independence of content, the seniority of the audience and what they're involved in, and networking.
Thank you so much. I cannot wait for the evening event then too. So few months still left, so cannot wait. And moving on, one of our favorite topics to explore in this vlog series, as I mentioned at the beginning in the title of it, is AI in healthcare. So AI is everywhere and it has become the buzzword of the day. What do you find unique about the use of AI in the transformation of healthcare?
I love the work that you guys are doing in AI as well. That's really exciting. I'm going to go with two that are probably that don't get the headlines as much. So about 5 years ago, maybe 4 years ago, I saw a pitch from a company who were using AI to trawl through all of the scientific research papers that were being released on specific disease areas to find like a correlation between the research that was released throughout the year and over time. And it's something that would take a human researcher in a lab an infinite amount of time to do. Like there's no way you could go through all of the research that is released on type 2 diabetes in 1 year. It would be possible. But AI can, and it can find these correlations, these links between research that can help to save lives and say, actually, this study from Finland matches this study from Poland, but there's a discrepancy with a study that's come out of Canada. And like, where does the truth lie? And what is it about different populations that impact the way that we read studies or the way that that data is collated and presented? And that was 4 or 5 years ago. At the time, that idea was too nascent, too embryonic, but they raised this year, I think they raised 24 million euros, can't remember. And it's a really exciting idea to me because it is something that uses AI without any, I can't see any ethical issues there, like any potential barriers to that being an amazing thing. Because if you're a researcher, you want your research to be out there being discussed. And if you are a patient, you want to know that every single avenue has been covered when it comes to the potential future of your treatment. So that excites me immensely. Like that's really, really cool. And then my health tech background is mostly in workforce and triage. I love the idea of AI taking these utterly redundant, painstaking human processes like shift swapping on a rota, for example, is a right pain for rota managers in hospitals, or like breaches of the European Working Time Directive in hospitals for staff, that kind of thing. And AI being able to find the best patterns for people, because it opens up huge opportunities for things like retention improvement. Because if you're treating your clinical workforce like humans who have lives, and they can tell the AI, look, on Saturday mornings, I take my kids to swimming. Like I can never work Saturday mornings, and Tuesday evenings, I like to get home early because my favorite TV show is on. Like these things that are actually never taken into account now. And then because rota coordinators don't have the time to do those things, and then you can use AI to be like, here's the optimum pattern with the fewest number of breaches and the best kind of outcomes for everybody. You make that an incredibly fair process, depending on how fair algorithms are, and that's a whole other debate. But B, you actually start to treat people like humans. So there's this delicious irony that you're using artificial human intelligence to create a sort of human emotional intelligence, which I really love. So that has never happened for clinical staff before. They never have their personal lives and needs and wants, particularly in the NHS, kind of factored in. So that makes a lot of sense. And with things like triage is obviously such a brilliant use of AI because we've had decision trees before and they've passed themselves off as AI in certain places. But the possibilities for AI in triage are incredible. So I'm really excited to see where that will go in the next few years.
Thank you. And that's a wrap up. So again, thank you, Henry, for taking the time to chat with us today. And we can't wait to see you in Health Europe next June. See you there then, and see you in Amsterdam.
See you then.